When I was trying to figure out what to do, I thought, well, let me find an area where I can have a large impact in medicine. And so I thought, well, gosh, heart disease is the #1 cause of death, so let me give that a pretty solid look. And so, I thought, let's have a big impact. Let's do something that I can understand and I can do every day and find it fun. The most important thing for me with this patient-provider relationship is to build trust with the patient. So they come to me and, ask them to be a little bit vulnerable. So it's my job to always tell them the truth, and over time make sure that they recognize that. And then when the time comes for us to do something that's, maybe pretty frightening for them, like, hey, we need to put in a pacemaker, we need to talk about a defibrillator, we need to talk about the end of your life or something like that. Then they know through a track record that they can trust what I am saying. They can feel comfortable knowing that I have their interest in mind. Every specialty thinks they're unique, but in cardiology, what I think is, I sometimes will meet a patient at their most extreme moment in an ER setting where we've got a life-threatening emergency. We'll take care of that in the hospital, and then we will continue to follow that patient on for many years in my clinic. Vice versa, I may have somebody that things have been very stable for quite a few years, but suddenly I hear they're in the ER, and then we get to go help them again in that emergency situation. We get to do all the imaging for the patient. We do a lot of interaction with their primary care doctors and the hospital medicine teams. Most coronary problems, we'll say, are lifestyle issues. Now, the tricky thing is that the day somebody has a heart attack, they often have chest pain, but it's not often the first time they ever had chest pain because, maybe every other day in their life it was heartburn, and this day it's a heart attack. So people need to be cognizant of some difference in their symptoms and be willing to come get evaluated. People so often come to us and they have chest pain and it's not a heart attack, and they apologize. They say, I'm so sorry, I wasted your time. But the truth is they didn't waste our time at all. We need to see a lot of people and take care of some people having a heart attack, some people not, and try to catch everybody.